Have you ever wondered how plastic surgeons perform labiaplasty surgery? So with this labiaplasty, I'm going to reduce the labia minora. It's common when you have labia minora that are too long that they can be really uncomfortable if they protrude beyond the length of the labia majora, which are the outside labia here. First step is to mark where we're going to incise. And the aim of this operation is to take off enough labia minora so that the labia then equal with the labia majora. But I can't stress enough how important it is not to take too much labia minora, which is an absolute disaster. Before I go any further, I'm just going to double check my measurements just to make sure I'm taking the right amount off each side. I'm going to actually inject local anesthetic. Local anesthetic is important in plastic surgery operations because it means that when she wakes up from the operation, she won't have any pain. The area will all be numb. But it also cuts down on the bleeding during the procedure, which makes it easier for me to see what I'm doing. Once the local anesthetic is working, then we can begin to really carefully and precisely remove the extra labia minora. And while I'm here, I'm just going to point out some important parts of the anatomy, just because I find that women often don't really know where everything is. So this is the labia minora, the outside labia where the pubic hair is the labia majora. This is the clitoris under the clitoral hood. And this hole here is where the wee comes out. That's called the urethral opening. And this is the opening to the vagina. I'll just repeat that process on the other side. And you see when I'm doing this procedure, I haven't actually just made a straight line cut. I'm not just picking up and pulling off the labia. What I'm doing is trying to replicate the normal shape or the curved shape of a labia minora so that after the operation, it looks like a normal labia and no one will tell that she's had the surgery. So after removing the excess tissue, what's left to do is to do the stitches. So at the moment, you can see all of her vaginal opening, the internal anatomy, and that's because on the table her legs are apart. But when she stands up after the procedure, the labia minora will actually come in and close over this area so that when you're standing, all you're seeing is one nice smooth curve with no bits dangling down. At the end of the procedure, what you can see is that the labia minora have been trimmed, so they're not as protuberant as they were prior to the procedure.